Hey, good afternoon. I'm Ed Ullman, the pharmacist at that beautiful wellness center located on the mountaintop community of Tannersville, New York. Early in the spread of the coronavirus, when New York State was the epicenter for COVID cases and deaths, here at Wellness RX, we tried to keep our community updated on the virus through regular video reports. And then when New York State announced that its transmission rates had fallen to the lowest in the region, we stopped the reports and hoped for the best. Well, as we've all seen, New York State's success has not been replicated by many other states. In fact, the United States is now reporting 200,000 daily new positive coronavirus cases, or our highest number ever. And the experts are warning us that the death rate will follow this ugly trend, especially as we enter the winter and flu season. While 3 to 4% of our general population has now been infected, 12% of healthcare workers are testing positive. So it now appears that the essential workers of America that have been on the front line in many different arenas may have a 300% increased higher risk of being infected than the general population. I think we all could agree we are tired of the masks, the social distancing, and the restrictions. But we must continue to work smart. Emotionally, we may be done with this virus, but this virus is not done with us yet. All right? Just remember that. Two areas that I'd like to address today, a little bit different, is testing and vaccines. Most of you are familiar with the intrusive molecular test that we now have that takes samples from deep into the nasal area down into the throat areas. And they use this to determine if you have an active infection. These tests have proven to be very reliable. However, they can be expensive, they're hard to get, and it can take up to 5 to 6 days for laboratory results to be received. So if you are testing positive and not knowing it, you are continuing to infect during the time that you're waiting. A second testing option is the serology test. And this test looks for antibodies in the blood to determine if one has had a past infection. That means we are not sure exactly how long once you get the antibodies from testing positive and having the virus. But it's getting more encouraging. We are seeing better results that it could be longer than we had anticipated initially. But this test, which tests the blood, which can be finger pricked right off your finger, is only testing you if you have had it in the past, and it is not reliable to tell you if you have a current infection. The third testing option is when we look at for pieces of proteins that make up the COVID-19 virus, and then we try to determine if they have those proteins, that they then have an active infection. This is a so-called antigen test. It only requires a swabbing of the nasal cavities. It can be a swabbing that you can do yourself, or the health professional can do it for you. But it is much less expensive, and it can provide results in as much as less than 15 minutes. Now we've gotten our license now to do this. We're all hooked up with our communication with the New York State Health Department. And I think strongly we're going to see that antigen testing is our future. But reliability has to be proven, and mass distribution has to be approved by the FDA. But look forward to this one. I think this is very hopeful. On the promising front, and this is really great news, 2 new vaccines that are now awaiting emergency use authorization from the FDA are showing a stunning 94+% success rate. That's 94+. This is unheard of in modern medicine. Now, while past vaccines, primarily for the influenza virus, was made with weakened or inactivated viruses, And then in a good year, these vaccines produce success in 50 to 60% of the vaccinations. These two new vaccines are what we call gene therapy, and it tries to manipulate the DNA sequence of the COVID-19 virus. And then with this manipulation, it allows for the development of a vaccine with a new genetic code that then goes and works to stimulate the immune system to make antibodies and immune cells to fight the virus. That's why they were able to move so quickly, 3 to 4 months, to be able to go through the trials and bring it onto the marketplace. Now, two companies that now have come out with producing their own vaccinations from the same gene technology is Pfizer and Moderna. And these are interesting stories. Pfizer is the big New York-based pharmaceutical company. Their research facilities right down in, I think, Pearl River. And they decided to take no money from the government. And they partnered into an international venture with a German biotech company. And this together allowed them to produce some very strong results from a double-blinded study of 44,000 individuals. So that is impressive. Now, Moderna is a Massachusetts-based biotech company that took $2.5 billion from the government to develop, to manufacture, and then to sell back to the government the vaccinations for the general use. And they did this in partnership with the National Institute of Health. Now, two different ways to accomplish the same thing. In the case of Moderna, this will be their first product they've ever brought to the market. For Pfizer, this is giving them an opportunity to establish visibility as a progressive pharmaceutical company in the United States. So interesting. Now, both of these shots or vaccinations are going to require two immunizations, probably be about 2 weeks apart, in order to get that maximum effectiveness of the 90+ success rate. And we know that the transportation of the vaccines can be challenging. All right, so we have some hurdles to go, but we're in the game to get our lives back. Now, considering the worldwide need for vaccinations and the need for, first, essential healthcare workers, our seniors, and then individuals who are high-risk patients, it's going to be probably about 8 months, where they're projecting on or about May, maybe June of next year, that we'll start to have vaccinations for mass production. Now, this could be accelerated if one of the other 50 companies that are now working on creating a vaccine, if they come up with good results from their trials, we can then bring more things to the marketplace. But it's going to take some time, but we're going to get there. In the end, this is a big breakthrough, and gene therapy holds great promise for allowing us to respond to virus challenges in the future. We have to anticipate there's going to be viruses that mutate differently. There's going to be new viruses that come out of nowhere. And this technology is going to give us an opportunity to be out front. Very, very exciting news for us. So as we take time to go into Thanksgiving and the holidays, and blessings to us all, I don't know if we've ever had an opportunity like this to just really find out who we are. We at Wellness RX are seeing great kindness coming from people, and it's just beautiful to see. We're trying to stay as focused as we can, as upbeat as we can. We got a great team that's here to be of service to you, our patients, our community. And we're doing our best. We understand that we are all being hit with technology now at a pace that we have never seen as human beings. We know all about what's happening with the COVID-19. We know we've never experienced anything like this, and we know that we are all dealing with protection of our democracy as America as a great nation. It's a lot of stress for all of us, and we're seeing how that impacts our kids, how it's impacting moms and dads and employers and all of it. So let's just hang in there together, okay? We need each other, and we will get through this. And these new vaccines are giving us great hope on the horizon. All right, let's just hang in there together, keep the faith. Happy Thanksgiving.